is a special time in a woman's life where her body is going through a lot of new changes, some of which are very difficult to adjust to. Menopause in simpler terms means no periods for a year or more. Unfortunately, the symptoms which are associated with menopause start as early as 5 years before the actual menopause and can continue for up to 5 to 10 years after the periods are over. Helping a woman to identify the symptoms and understanding that this is a normal transition that she has to go through helps her to come to terms with these new symptoms. A lot of women believe that menopause is now coming at an earlier age. However, this is not true, and the average age of menopause in India is still in the late 40s or the early 50s. However, what is happening is women are more aware of the changes that come with menopause, and they're more likely to actively seek treatment from their doctor. Unfortunately, treatment of menopause, there aren't many options. What you can do, however, is have regular exercise, do yoga, do relaxation techniques, and basically keep yourself busy. So join the baking class you've always wanted to join, go for a Zumba class, and basically keep yourself busy all the time. This will help to divert your mind away from your symptoms and deal with your menopause so much better. The menopausal symptoms in an individual woman can be very variable. The commonest symptoms are psychological symptoms, where the patient feels low on energy, she's tired all the time, she doesn't do her daily activities with the same enthusiasm. She can have a lot of mood swings, being irritable and getting angry at the slightest provocation. She can also experience what are called as vasomotor symptoms, where she feels dizzy on getting up suddenly, she feels hot all of a sudden, and sometimes suddenly feels cold. She can also have what are called as urogenital symptoms, where because of the dryness of the vagina, they can have difficult or painful intercourse, frequent urination, or frequent urinary tract infections. She can also have vague symptoms like body aches, joint pains, and swelling over the face or the feet. The biggest risks a woman faces during menopause is osteoporosis and cardiovascular diseases. Estrogen is the hormone which is basically responsible for keeping your heart as well as your bones healthy. In absence of estrogen, your bones become soft and you are more vulnerable to osteoporosis. That is why it is very important to screen for osteoporosis once you become postmenopausal. Similarly, once estrogen hormone is gone, your heart becomes more vulnerable to heart diseases. That is why it is very important to have regular exercise, keep a modified diet, and make sure you go for regular health checkups to ensure that you have a healthy menopause. In women who have very distressing hot flashes, we can actually use hormone replacement therapy. However, the minute we talk about hormone replacement therapy, women are very scared because there's a lot of negativity associated with hormone replacement therapy. However, in a woman who is newly menopausal, that means it's been less than 10 years since she started her menopause, if she does not have uncontrolled diabetes, uncontrolled blood pressure, she's never had blood clots in her legs, then she can safely take hormone replacement therapy, and it works very well for the hot flashes.